one?
I like to keep them in.
Oh, okay. So now are we going ahead and applying topical?
Is someone going to read for her?
Topical number 11.
Assistant will place the topical anesthetic on the gingival area 3 to 5 minutes for the best results.
Okay. So
Go ahead.
it's been 3 to 5 minutes.
Assistant will pass the anesthetic syringe to the dentist and have one of the devices to place the needle cap in it so the dentist can recap the needle. Anesthetic takes 7 to 15 minutes.
We're not engaged. Just saying.
Did you engage it?
The assistant will wash dry patient's mouth with the air water syringe and the saliva injector.
Okay. Well, the water would be coming out.
Assistant will pass the explorer to the dentist to check for
I think that's leaking and that's our problem.
Okay, so I'm passing the Explorer. Check for numbness.
Assistant will place the correct size clamp for the tooth you have chosen, rubber band material and frame.
So I'm going to warn you guys now. When you do this already set up, you don't want this one, or this one attached. And you want this just a little looser.
Okay.
So you have like
Play.
mm-hmm.
Okay. And then.
Nope. That on first.
Okay. To make sure it's locked.
So
Use the other hand.
locks it. Unlock.
Oh, okay.
Lock.
So I. I'm afraid of like cutting off their breathing.
Always make
What's
sure you take your fingers and make sure it's down around the tooth so it doesn't pop off.
Okay. And then.
Get it on there. And that's when you would tighten it if it's on when it's on there. Correct?
Yes,
So would I want to move this up above the teeth?
you can.
Okay. And so the dental assistant just does that.
Now I see why that some people don't do it when it's on.
Okay.
Dentist will prep
See
the
how
tooth.
it's tight all the way around? I will mark you if that is not tight all the way around. If it's
So
like,
is this loose?
if
Too
it's
loose?
like this,
With the bubble?
because you're wanting to keep the water in there.
Okay, so like here's a bubble.
Yep. Perfect.
Okay, so that looks good to you?
Mm-hmm.
Okay.
Dentist will prep the tooth you have chosen with a high-speed handpiece.
I need the glitter. So when you, no. Where's all your instruments you thought you needed to be? No? So you need to get this. This is for isolation purposes,
Okay.
right?
So you're doing what they were using in law school, right?
Yeah.
No, floss is to go in between the teeth.
And I probably shouldn't have done those holes.
No, because we're only isolating the one.
Okay.
But
Okay,
so next
now
time you do it, just the one. Yeah.
Okay. So next,
using that high-speed dentist, then we'll cut to 5 to 7 miles per
And then the man.
near me. Just kidding. Here, just take it.
I just want to use AC and air water syringe while dentists prep too.
So would I be back here?
Yeah.
Okay. And then do I use the water while you're filing?
No.
Are we good?
When the dentist is done, the assistant will power wash dry the shoe thoroughly after prep.
And water, power washing.
Dentist will now prep with the fluid behind teeth, using RA round first. Are they in here? Let me see, TV number.
And would I power wash that?
Use a mirror in here. If you want,
No, we didn't have any.
I don't think we have disposable mirrors in here.
We normally don't have disposable mirrors.
They're supposed to be in those rooms.
Okay, so next, so you did this first and teeth.
Did you wash them out?
Okay, I rinsed out the mouth. It's not working.
Assistant will change the HDE tip to the third.
That's because the bottle's not in.
Oh.
Lightly rinse the tooth with the third water syringe. Be careful not to spray water or air straight down into the canal. This can cause air embolism.
Good try though.
So got down in the
See how they're.
Yeah, I see. Won't do that again. Lesson learned.
Okay, assistant will pass receive endodontic spoon evacuator to remove any remaining caries while holding a 2x2 gauze to wipe off any debris left on the spoon.
So very important with this one, if the provider has their loops on, they're not going to look away from the hole. So you guys have to go to them.
Okay.
If you're doing endo.
Assistant will pass receive the millimeter file to the dentist.
And it won't matter because
Yeah, so the
the
millimeter
smallest
file and the files, both those steps are in one. But they need to go in order.
Assistant will set up the files in order from lowest.
So if you're going to hold it like that, these guys need to all be, he stays there. Yeah.
Okay, so it's white, yellow.
Lowest
It has
to
numbers on it.
Oh,
Yeah, there's
Okay.
numbers on them.
so 15, 20, 25, 30, 35.
And hold at the patient's chin and endodontic. Oh no, just that.
Okay.
That's what you're holding. The dentist will try to file into the canal if you wanted me to.
You can practice on Bob if you'd like in room 6.
So lengthen those right and adjust the rubber stopper to the crown of the tooth.
Oh,
The rubber stoppers are right here.
okay.
So they just
Sorry.
they just put it right here and they would measure how long it is. So in real life, we have another pair of cotton pliers. No, I'll just use Explore. So I wouldn't be holding the mirror right at the moment.
You want me to take it?
But they would put the file down in there, and then they would take usually the cotton pliers, and they just make that rubber stopper hit like the cusp of the tooth, and that's how they get their length.
Oh, I see.
And then they would measure it.
They remove the files and check the measurements. And then the roller then puts out back to the canal. The recipient needs to be ready to write down the canal if more than one, the file number and the length of the file on the tray covered. Example, CB number 20 at 21 millimeters. CL 25 at 23 millimeters. Depends on how many of the canal.
We have 3, so.
Okay. So I write that down. Okay.
Sorry, do you want to ask me later about it or no? Okay. Sorry, Jackie. Assistant will place the lead apron on the station.
Lead apron.
Lead apron.
And you don't have to, you can just pretend like you're grabbing it and put it
That's
over.
it. Put the lead apron on. We're gonna go ahead and
Assistant will remove the rubber dam frame.
But it takes that whole 24 hours for it to totally set. Now, back in the day, they used to have the patient come back in 24 hours to polish. But nowadays, you don't have the time for that.
No, you just pull it this way. But the files are in there right now. Because that's what we're taking a picture of.
okay. To make sure that they're
Yeah, can you just hold
yes,
that?
ma'am. Second.
Gently pull the rubber dam material towards the tooth. You're taking an X-ray. PA.
So goes in, slides over all that stuff. Not that you can get it because he's in there. Beep, and then slide it out.
Okay.
So, in, down, slide.
So would they bite down at all? So when we place it,
Not
it's
on
like
this one.
Okay.
Not
No,
on endo.
it
You
is-
have to hold it. You're with me, or
Goes like
place
this.
Okay. So at that ankle. Okay.
It's not easy on this. But you need to come in like this and over the files. Otherwise, you're going to shove them down in there farther.
I see.
And then you
Okay.
make your provider unhappy. So,
Gently get into the dam material without pushing on the files, and have the patient hold on to the stat or endo ring. How do you say it? Endo ray. And explain to the patient how they cannot bite down, or the files may be pushed down through the apex of the tooth. So, yeah.
sometimes with this version, you can have them bite down on it, but you have to make sure the files aren't sticking up over it.
Assistant will take the X-ray, remove the hematostat, mark the ring, film on it. Rinse out the patient's oral cavity with the saliva ejector, and then place the rubber dam material back into the frame.
I would use this.
Okay. So and just suction it out.
I would probably rinse it because a little bit.
All right. So
Because you might get some taste under
suction.
there.
So take off the lead apron hanging on the back and go develop the bone. Okay? Then just remove the files and compare the length to
When
the
did we put the frame back on? I would do it right after we remove
Yeah,
that.
I already said so. Patient oral cavity with the saliva ejector.
Over the chin. But always the top first. Do you know why? Because if we start from the bottom,
It's gonna break.
so watch someone, just watch me put the bottom on first. Because this is what I see. Like, I'm over the patient's face, and I'm worried about what I'm doing, and I'm not worried about where this is going.
Okay.
So if you put the top on first,
You're more aware of it. You have more control
it
of it.
doesn't go, yeah.
Yes, a lot of double tap receipts, so make sure you guys are using that receipt and really getting that out there. You're giving your operator enough working room to grab the instrument.
Look, now we're getting it up there.
So this is one that you have your end hook so that the operator's going to
I'm taking the files out.
Okay, then just remove the files and compare the length with the x-ray. If all looks good, they will proceed with the procedure. But if the length is off, they will adjust the rubber stopper accordingly and have the assistant retake the x-rays. That was it. If the file numbers are correct, the assistant will use the measurements given. Otherwise, you will need to write down the new measurements.
if you don't tuck it? Oh. Yeah. And I did not mean to say.
Make sure to save your measurements and add them to your claim notes.
I'm not finessing.
Assistant will need to have 3 storages filled with the same solution.
Okay. So she was right here. I took these files out and we put them back in.
Okay. Fine.
There. She was reading it as we were putting the dam back on.
Is it the same thing with passing the syringe? What else? Okay. The surgical MP.
Yes.
Doesn't say that, but
Do I put this in the cap?
Yes. And it all depends on, we never recap them. You have to grab the lid.
And now it's not working. Oh, maybe it is. Okay.
There, go like this. Yes. So you should be right in there with me.
Yes, ma'am.
So I know why.
Do I keep on or just pass you the next one?
Next one. But you don't have to keep suctioning.
Okay. So this is where I put the suction.
I would just hold it,
Okay.
however it's more comfortable for you.
And then figure out a way to pass this?
Yeah.
Okay.
So the only time this needs to be in there is when I go in.
Okay.
Okay?
And am I suctioning everything out that you're putting in?
Yeah.
Okay. So we're gonna go ahead and do the third one.
See, I'm putting this one up and you've already got it ready. Yay! Perfect.
And suction.
when done irrigating, assistant needs to place a surgical suction over the canal, streaming as much excess liquid as possible.
You already did that. Just this guy.
Okay, no water.
So when I'm out, you just in all the canals that they've opened.
Assistant will double cross the hard points with the locking forceps higher to the dentist so they can dry the canal. This will take multiple paper points to thoroughly dry the canal.
I stole it from Endo just to get a chair.
What am I doing wrong?
So I'm just going to show you. So grab the other one real quick.
Other paper points?
Yeah. And the other cotton forceps.
Cotton or the locking?
Locking.
Okay.
Same thing though. It's just lock. So I want you both to watch. There's, I guess, only 2 of you. All of you to watch. So if you hand it to me like this, I'm going to have to adjust to try to get it in there. Like, are you seeing my struggle? But if you hand it to me like this,
I can flip it the other way.
Okay.
okay?
Oh my god, look it up.
So hand it to you with like this. Please.
Okay, not the other way.
This one will take multiple paper points to fully dry them.
I need another one. I need another one. So I have at least 3 canals,
Yeah.
but it depends on how infected it is. So we're good.
Okay. Assistant will mix the sealer on the mixing pad with the metal spatula in a figure 8 motion.
Are these the sealants?
Yes.
Okay.
Sealer.
Sealers. Sealer. Okay, so I opened one, opened the other. And then what do I mix it with?
Spatula.
Okay, I'm mixing sealant.
And you want to do it flat.
Oh,
And then wipe it off. And you need more of this, because did you guys do amalgam already?
Yes.
You need more of this than you do the die cut.
Okay.
Okay.
That's why you're using
So
the
like a
spatula.
pea size of both? Or more than a pea size?
No,
Okay.
I'd say about a half a pea size.
Okay. And so
No, that you need to wipe off.
with the 2x2? Okay.
So will you read that step again?
Assistant will mix the sealer on the mixing pad with a metal spatula in a figure 8 motion. You will need a base and a catalyst to mix the sealer. Assistant will roll the master cone with gutta percha.
Gutta percha. That's a paper point, isn't it?
Yeah, gutta percha.
this one.
Okay.
Roll the master cone in the sealer to the file measurement and the locking force applier and double pass your sheet with the spreader condenser to the dentist so they can place it to the canal.
So you have your measurements written down on here. So you would measure it on here to the same thing, and that's how far up on here you would put the sealer.
Okay. And then do I weave like this or just
You
have it?
roll it.
I roll it?
Gutta percha in
Like that?
the sealer.
Yes.
Okay.
Okay.
So it's filling off any little dent and tubules that is not going to be filled with the gutta percha.
Is it one gutta percha per canal?
Yep.
Okay, so we should have 3.
Yeah.
It's way more than that if we're doing this technique wise.
Oh,
You'll see why in a minute. So we'll just use
so many on
Yeah.
that video.
yeah. So I'm gonna just use paper points.
Okay.
So that's a gutta percha. Okay.
I just got some extra good pictures. Okay. After that.
I need 3. I have 2.
Oh, excuse me.
I feel like I'm gonna be shaking. I probably agree.
It's easier to pick them up and place them.
Okay. And then I'm rolling it into
Yep.
the good stuff.
Yep.
And then I would get another one ready.
So I've got all 3 canals filled. So what does it say now?
Okay, let's see.
She used a
Oh, paper.
paper one for the other one.
One master cone is used for each canal. That's all it says. The spreader condenser to the dentist so they can place into the canal. One master cone is used for each canal. Assistant will have a 2x2 gauze ready to wipe off any excess sealer. Assistant will dip the end of the accessory into gutta percha into
So-
the sealer.
You're gonna pass the spreader, and I'm gonna spread it, and then you're gonna, I wipe it off, and then you're gonna pass an accessory to me.
What's an accessory?
Gutta percha. It's just a smaller one. I think all we have is,
So those gutta perchas for like with
the first one does, but our canals come like this, so we have more space in there, and we need to fill that all up with something. So this will make a little bit more room, and then
Are we done with it?
no, you're gonna have to. And you don't technically need to wipe in between. So I spread it. I need the spreader back because I'm gonna fit as many as these that'll go in there,
Sorry.
and then another one until it's full. Does that make sense? So you're filling that hole. Not that any of them are staying in there. If Zoe's getting a good picture, they're like all in the back. So you just keep spreading and filling and spreading and filling. So I want you guys to pass it at least a couple times.
Okay.
So yeah,
And that's the gutta percha, the small.
yes. So the first one is the accessory that actually fits
that's the same size.
all the way down to where that matches these guys.
Okay.
The other ones are just thinner ones, all usually about the same size, and you just keep putting them in there until you can't put any more in.
Okay. So let's start.
Wait, I have a question. So, do you have to do the gutta perchas all separately, or can you have them all laid out on your?
You can get them laid out after you take the x-ray, because then you should know what size you need.
Okay, and this stuff won't dry out.
as long as you don't touch them together.
Alright, so assistant will have a 2x2 glass, wipe off any excess. Assistant will dip the end of the accessory gutter perch onto the sealer in the locking forceps plier and double pass receive the spreader condenser to the dentist to fill the canal. You will need multiple accessories to fill the canal, so you will need to repeat the step multiple times. Assistant will have a 2x2 glass ready to wipe off any excess sealer. Assistant will heat the glick with a lighter. That's funny.
Oh my God, she just totally burnt her hand. Where's the glick?
The glick.
We need a glick.
I got a lighter.
Come on, glicker.
With a lighter on it.
Glick,
Well, that's
glick,
what Miss
glick,
P said she
glick,
did in the
glick,
office.
glick. I know. Yeah, but you still need the glick.
Oh. Oh.
You have to heat something.
Okay. Oh, I see. Is that why this is black?
Yes.
Okay, so we're heating this.
Yes.
Done. Not passing.
Oh my God. She's burning herself. And
Okay, that wouldn't really
nothing
happen.
left.
Okay.
Well, most offices they'll do it themselves. So we don't
What do I
burn
need?
ourselves. Cotton fly.
So you're supposed to clear off the end of the gutter perch.
And is she supposed to suction and hold cotton pliers?
While the assistant holds the gutter perch with the locking cotton pliers, use the HVE to suction the smoke.
Oh. Surgical? Section.
You can, if you,
It says HVE.
yeah,
HVE. So
Okay, so I would change a note prior to handing you that.
yeah, other side.
Okay.
So you need to grab the gutta percha. I'm heating mine, and then I'm just cutting them off, but you're taking them all.
Okay.
Perfect. And then I'm the provider, most likely. You're supposed to take it back and then heat this side.
Okay.
You can hold on to that. And then this side packs it into the hole.
Passing smoke.
Yep. That's why I learned to section, or yeah, section with that hand.
Okay.
We'll clean off the
Right
cleat.
hand.
Assistant will clean off the cleat and heat up the plug your condenser.
We already did that.
Okay. For the dentist, so they can check the gutter perch back then. Assistant will pass receive a cotton pellet dipped in alcohol. Stand up.
I know I'm supposed to have a different chair, but
Watch your feet.
we're doing. Okay.
You're fine. Someone else must need it. Whoa!
What's the? Okay. Next.
Assistant will pass receive a cotton pellet dipped in alcohol. Should be in a disposable dappen dish on a tray with a tray setup.
Yes! Yes. So this is just cleaning out anything like the smoke residue and any excess sealer.
Okay. Assistant will pass receive a dry cotton pellet with the locking forceps so the dentist place
So you need
over,
multiples out, please.
Okay.
placed over the gutter perch.
Oh look, now you have two. Watch. There, you can't get it out of there without contaminating it. There you go.
Okay.
I just
There we go. Do I need something in my hand right now?
Assistant will squeeze some cabbage out on a clean mixing pad. Take up the paddle end of the glick, and pass
you gleek it all you want.
and pass receipt to the dentist so he can condense into the prep.
That's the cabin.
Yeah. I did that in the video.
No,
Oh.
it's usually on here.
Oh, so I wouldn't mix it on the paper and put it on there?
You don't mix.
Okay, great.
It just says squeeze some cabbage out on a clean mixing pad.
Okay.
Okay. Or you can give the condenser to the prep. Assistant will pass receive a cotton tape applicator dipped in. You don't have a cotton applicator. You see that?
That's the cotton tip applicator.
Okay. Pass receive a cotton tip applicator dipped in the water to the dentist to remove any excess cabbage.
That was alcohol.
Do I need a different dappen dish? Okay. So we need two, one for alcohol, one for water.
Yes. And I do different colors.
Okay. What's next?
So she's just speeding up the drying process.
Oh.
Now we're gonna remove the dam clamp. No, you don't need to do that. That's what the
Oh.
cotton tip was.
Okay.
Just telling you what
So
to
now
do
we're
that.
I think in the procedure though, you should rinse right now in case there's any excess.
Okay.
And it's all covered.
Oh, now it's working.
Is that dry?
Yeah,
Then dry.
it was pretty good.
Assistant will remove the rubber dam clamp material and frame.
No,
Do I?
you're gonna want to take the whole thing out together. It's 100 times easier.
Okay.
It comes out as a whole.
Yes.
Oh Lord.
And then it's actually saying
Just squeeze it. Just don't even worry about locking it. Perfect.
Yes.
now it's saying to wash the mouth and ear.
Yeah.